When I was doing my bachelor's degree in Puerto Rico, I started working in a community health organization that worked with homeless people. We went to different stations around San Juan and give them food. We talked with them, and I wanted to be a medical student. But when I was doing that, I felt like, okay, I'm doing healthcare work, but I'm not in a hospital. I'm not in a clinic. I'm not even in a school. I'm just in the streets. Like, what is this that I'm doing? And it ended up being public health. It's just like looking at the system in a broad way so that you can help the most amount of people. And then when I knew the concept of public health, I knew this is it. This is what I want to do for the rest of my life. So that experience, I think, made it extremely personal. I think that prevention and improving the quality of life of people is the most important thing.
That was today's guest, Sergio Rivera Rodriguez. Hello and welcome back, everybody, to Making Public Health Personal. This podcast is brought to you by the CUNY Graduate School of Public Health and Health Policy in New York City. I'm your host, Laura Meoli-Ferrigon from the Office of Online Learning here at CUNY SPH. I'm excited to bring you all new episodes of this show, so thank you for listening. Each episode of Making Public Health Personal focuses on an aspect of health and social justice that affects our daily lives. We'll learn from expert faculty, researchers, alumni, and students on how public health policy, advocacy, and practices can benefit our ever-evolving community and our world. You don't have to work in healthcare or have a PhD to understand these topics. We're going to break them down for you and give you practical tips to make a difference. Today's episode is about healthcare. If you thought our healthcare system was dysfunctional in these 50 states, you might be surprised to hear about the corruption and lack of access and affordability to healthcare that most Puerto Rican citizens face on their island. Our guest today is Sergio Rivera Rodriguez, a doctoral student here at CUNY SPH studying community health and health policy. He has a master's degree in public health from the University of Puerto Rico with a focus on epidemiology and biostatistics. We'll talk about his current research project, which investigates the healthcare system in the U.S. Commonwealth of Puerto Rico, with the goal of expanding healthcare coverage to every citizen on the island. We also look at the healthcare policy options other countries have in place that might be working more effectively, and how we can use this research into Puerto Rico's system to create better healthcare access, affordability, and satisfaction here in the United States. Thank you for joining me today, Sergio.
Thank you. Thank you for inviting me, Laura. It's a pleasure to be here and speak about these topics that I think are very relevant in the context of US. The things that are happening in Puerto Rico are just crazy. I'm going to try to narrow them down, but there's really a lot to talk about.
Yeah. Before we jump into that, you are a CUNY SPH student right now. What is that experience like?
Well, it's been great. I'm in my third year right now in community health and health policy track. And the first year was online. So I was in Puerto Rico taking the classes. That first year was a little bit difficult, but then the second year I went to New York and it's been like more hands-on in the classes and the research experience. But I have really enjoyed the experience. I love CUNY. And I really found my passion here. So I've been studying these topics for a lot of years, but I really found my passion in CUNY. So I'm very happy with CUNY SPH.
Awesome. And tell me about your project.
Yeah, so right now, that project that we're working in Puerto Rico, we're basically a group of medical doctors, like physicians, medical students. We also have lawyers, and we're trying to integrate more people as we go on. And we're basically like gathering information about the healthcare system and just sharing it with the public right now. What's happening? Where is the money? Things that really our health department doesn't gather, like that information. And we're trying to gather it, understand it, and sharing it in a simple way that everyone can understand it. Just basically to create consciousness and educate about the healthcare system in Puerto Rico and all the problems that we have.
So tell us about some of those problems, the dysfunction of the Puerto Rican healthcare system.
Yeah, so I think that the main problem in Puerto Rico is the privatization of our public healthcare program. So basically, 100% of our Medicaid is privatized, so it's managed care. It's basically all the funds that go to Medicaid passes through the hand of private health insurance. And 94% of our Medicare program passes through the private health insurance. So the number in the US of Medicare privatization it's like 40% around nationally. In Puerto Rico, it's 94. It's the highest in all
Wow.
the nation. Yeah, it's the highest in all the nation. So there's a lot of research that I can share that it's basically that managed care, it doesn't augment the quality, it just increases the expenses. Because in the 90s, there was this neoliberal thinking that privatization was going to be more effective on giving the people their services. It was like a test. And after 25 years or 30 of that happening, we have seen like the outcomes have not been right. So yeah, that's one of the problems.
So these private companies are pretty much taking a cut of the funding that patients should be getting from their benefits.
Exactly. Yeah, and that also happens in the States, but it's not at the level of Puerto Rico. And it's really at this moment, it's like an opinion that I have, but it's shared by a lot of people that it's not working. And in the US, you can find a lot of literature on how states that have like a high privatization don't have better quality, but expends more in their services, and the money doesn't get to where it has to go. So we have seen in 2020, for example, private insurance companies, they broke the record of their more profit that they made. That also happened in Puerto Rico. But the thing that is happening in Puerto Rico is that while that is happening, people have less accessibility to the hospitals, their medical staff. Also, the insurance companies have made the life very difficult to health professionals. So in the island in 2010, we had 18,000 physicians. Right now, like 12 years later, we have 8,000. So a lot of people have like left the island, and that's also a huge problem that we have.
So there's a lack of medical professionals.
Exactly. Yeah, there's a big lack, and that's something that it's always talked about in the news, but the solutions that they have for those problems are like helping them, the physicians, to give them some money or lowering their taxes. But in reality, I think that those are not strategies that have worked. And it's really like we have to reconceptualize all the healthcare system, similar to the US. Like, in New York, they have the New York Health Act campaign that is basically also to look for a universal healthcare system. And in California, I know that they're working in similar projects to that. So it's basically imitating some of those projects that are happening there and trying to put them in Puerto Rico. And there's really a lot of people that want that. It's just that the health department doesn't have like all the data that we need. So we have to like scrape on those data to do our arguments.
Yeah, it's surprising. You would think, or I guess I assume, a private company would be a little more efficient than the government at providing care to patients. And also, I would think that medical professionals would probably get a larger salary and more money working with a private company. But you're saying that that's the opposite is true.
Yeah, in my opinion, the opposite is true. And I normally compare Puerto Rico not only to the US mainland, but also like to the other countries like UK, Spain, Canada, Japan. Those countries don't have private health insurance. It's more than private companies, it's private health insurance companies. These ones are basically like an intermediate that is not necessary in our system. So basically what is happening in simple words is that our taxpayer dollars goes to like tax, government, then private health insurance, like an intermediary, and then it goes to like direct healthcare. Mm-hmm. So in other countries, health insurance companies are not in the middle. It's basically taxes, then the government, and then directly to healthcare. And that middleman, that middle company, basically what it does is like grabbing some money. In my opinion, again, it's not like there's other people that are going to argue that no, but they make it more effective and they give better services to the people, and the government could not handle all of that. But if we look at other countries, that's not true. And if we look at how effective has been the system in the US, that we are the ones that expends more in Puerto Rico too, and we don't have the best health outcomes. So something is happening here, The average in the world, in the developed countries, is like 8 to 10% of their GDP. In the US is 16%. And in Puerto Rico, it has to be about like 14 or 15 of our GDP goes to healthcare too.
Wow. So what is it like for a doctor working in Puerto Rico?
So for a doctor working in Puerto Rico, the new doctors that have come around like have a very difficult time because these health insurance companies can just say to you that they're not going to accept you in their network. So you end up like not having a work when you graduate. And in here, like the debts are similar to the US, and the salaries, the wages for the physicians and the nurses and all the staff are way lower than in the US mainland, even though they graduate with the same debt. And that's one of the reasons why the health professionals are leaving the island, because they have the similar debts that in the US mainland, but the wages are lower. So they travel to the US mainland to have better salaries, sometimes like triple what they could make in Puerto Rico.
Wow.
Yeah, the people that are coming up as health professionals like have the most difficult time. But yeah, we also have some doctors that are good and have a good salary similar to the US, but you really need to have like 25 years of experience. And it's very hard. It's not like in the US that after you graduate, it's like you got a good salary and you can start working towards that. So yeah, that's a quick introduction.
Yeah. And there's notoriously some power and energy issues in Puerto Rico.
Yeah, that's good that you highlight that. So right now, it also comes with privatization. We had a monopoly, like a public energy source, and I think like 2 years ago, it became privatized by a company called Luma, and that's like one of our biggest problems. After they were introduced, the bills that the people pay for their energy went up, and the power outage are crazy. Like there's already data. There are places that the light goes at least 3 to 4 times a week. Like that's the thing that we're having right now. And yesterday, like literally yesterday, there was a hospital without energy. The pediatrics area was without light, and there are videos of that. And like a week ago, the biggest hospital in Puerto Rico was also without energy for like 20 hours, something like that.
Wow.
Yeah, we're really having a big problem with that. And that's another whole issue in Puerto Rico. But it's also affecting healthcare. We see it in those hospitals. We see it on like how people are working in their offices. They don't have light, so they cannot access their electronic records. Even in the medical students, some medical students want to like study, but they don't have light, so they cannot study at night because everything right now is with computers. So it's just affecting everything, not only healthcare, but also education. And yeah, that's a big problem. Thank you for pointing that out.
And who oversees the private healthcare companies in Puerto Rico?
It's supposed to be the Department of Health, but the Department of Health created another office that is called the ASES. It's like a specific public organization that gives the contracts to the private insurance companies. So the thing with this public organization is that they get their taxpayer dollars and then they make contracts to the private health insurance companies. But they also have to oversight them. Like if they do something wrong, if they get more money that they should like oversight them. And also the CMS, also that is a federal public organization, they also oversight private health insurance companies in Puerto Rico.
Okay. So there's a good amount of management and middlemen involved.
Yeah.
Overall, how many people would you say have health insurance in Puerto Rico? You would think that having all this oversight, that it would make sure that people have it.
Yeah. Health insurance in Puerto Rico, there's a interesting thing to mention. So we are a very poor country. In the US, the poverty level, it's around like 12 to 20%, something around that. In Puerto Rico, it's 45%.
Wow.
So most of the people, like almost half, are like live under the poverty level, and most of those people get Medicaid. So in the US mainland, most of the people have employer-sponsored insurance, so you get it through your job. But in Puerto Rico, most of the people have Medicaid, the health insurance for the poor. And there's also a big proportion of people with Medicare that is like the older population. We also have a very old population because the young people are leaving the island. And there's also people that have employer-sponsored insurance. But the biggest amount is the Medicaid population. And so the numbers in Puerto Rico are not great. And that has even been said by the Secretary of Health. And we don't know if there are like 10% of people without insurance are around 20%. It's around that number. We don't really know exactly how much is it. There has been different ways to like measure that, but no one has come with like a definitive number. And that's one of the things that our group and our research want to do, like finding those numbers, who are these people and how can we work to expanding coverage to everyone. So around 250,000 to 600,000 people are without insurance in Puerto Rico.
It's a big variation. It's good that you would be able to narrow it down.
Yeah. So if we don't know that number, that's one of my arguments. We cannot work with those people. We don't know who they are. We don't know if they're like older people or younger or college students, or we really don't know like which population gets in that range.
If you dream of making a difference in the world, a public health degree or certificate can give you the tools to do just that. The City University of New York's Graduate School of Public Health and Health Policy equips public health professionals to advance not only a healthier New York City, but a healthier world for us all. We want you to join us in our mission. Visit sph.cuny.edu to learn more about our programs. No matter where you are in your career, CUNY SPH offers a broad range of degree and certificate programs to not only help you advance in your career, but to have a real impact on the world. Public health professionals are needed now more than ever. Join us. Visit sph.cuny.edu to learn more.
And in the US 50 states, I think a pretty popular way to gain health insurance is through your employer. And in Puerto Rico, that seems to not be as popular just because of the population that's being served. Why is that not a great system overall?
Yeah, I think that the problem with employer-sponsored insurance is that it's through private health insurance companies, and these companies are for profit. So basically, the money that you're giving in, there's a big portion that is going to your healthcare, but there's also a portion that is going for profit. And that's something that doesn't happen in another country. So a lot of that money that is being held by the private insurance companies that you think it's supposed to go to your healthcare, then it's not going through you. And then in the US and in Puerto Rico, with these private insurance companies, we have the pre-approvals when you have to that, and the co-insurance and the co-pays and all these different things that confuse people. And when you get to a hospital, you're really afraid of like how big is going to be your bill, even if you're insured. If you're uninsured, it's worse. But even if you're insured, you're like afraid if something happens. And people, delay care or even forgo care to not pay those bills. So that's why I think that doesn't work, because that having that fear for an essential service, it's not common in any other country. Well, there are other countries that have systems like that, but in most of the developed countries, that doesn't happen. And I know that the US and Puerto Rico have the capacity to do that, but it's just that those companies are so focused in profit and increasing their profit every year because they have investors, and the investors have to look that, oh, these people are growing. How they grow is that they take a little bit more out of your premiums each year for them. That's one of the reasons why I think the healthcare system in Puerto Rico specifically is collapsing. Like, well, as I told you, people are leaving the island, health professionals. People have to wait like 10 months to get services. They have to wait in lines for things, even if we have the same system as in the US. I think that there's no space for profit in healthcare unless everyone has accessibility and not fear of entering services. It's not like moral to me to having a lot of profit while people are suffering and while people are underinsured or uninsured. So yeah, that's what I think it doesn't work.
No, that makes a lot of sense. And as you said, there are a few different types of healthcare systems throughout the world, and they have varying levels of success and satisfaction. What do you think would be the best solution for the United States and for Puerto Rico?
I love the one-payer system. It basically takes out the private health insurance companies. It leaves the hospitals and some clinics private. So it just like works with the private health insurance companies that I think is like the epidemic of our healthcare system. So the one-payer system, how it works, it's basically like the government is the only insurer. And that's good because the government, it's a monopsony. That is the opposite of a monopoly. So they can negotiate all the prices with hospitals and with pharmacies and other essential places that we need. So right now, what is happening is basically because we have private insurance companies, there's a lot of them. And all of them have to negotiate with pharmacies, and all of them have to negotiate prices with hospitals. So maybe you have one private insurance companies and you go to a hospital to get I don't know, cancer treatment, for example, and you pay $10,000. But another person with the same condition, because they are underinsured, they have to pay $30,000. And it's because our system is very fragmented. So with a one-payer system, basically what happens is that all the prices are similar for everyone in all the hospitals. So if you go here, the state is going to charge the hospital this amount, and that amount is going to be similar all over. And at the end, that works better for the patient. That is like the end goal of changing the system. Right now, the system doesn't work for the patient. Right now, the system really works for the profits and all of that. Like the end goal is not the patients. So yeah, that's the one that I think. But there are also other systems like the Bismarck model, that is the one in Germany. They basically still have the private health insurance companies, but most of them are not for profit, and they are like extremely regulated. Like they cannot negotiate the price like in the US and in Puerto Rico. They have like a standard amount that they have, but they have to like manage their money inside those range. In Puerto Rico and the US, like there are no specific range. People can negotiate prices as high as they can.
Yeah, that can leave a lot of people with varying levels of care, and then kind of unfortunate for lower income people, they just won't have the best options.
Exactly. Yeah, that's what's happening right now. Like if you have the money and all of that, you're going to have a great healthcare system in the US and in Puerto Rico. But if you're under the poverty level and all of that, you're going to have a really bad time navigating the system. And if you're uninsured, to me, like the most important population is the uninsured, that we have that population. Those are like the worst ones. They try never to go to like hospitals and all of that unless they have like a big problem. And that's also a problem because if you have like a, I don't know, stomach ache and you don't go to the doctor to like, I don't know, get some antibiotics, something that can help with that, and you end up like delaying that care, then like 2 years later, you're going to be in a worse condition. You're going to spend more in the system. You know, you're going to end up using more resources because you only went when you had an emergency. Yeah. And that also causes a lot of stress when the medical bill comes.
Yeah. There's a lot of stories about people of different income levels getting a catastrophic bill in the mail that they did not expect. And even when you have insurance, going to the doctor, you're never sure if they're going to cover everything.
Yeah, and that's something that really needs to end, in my opinion. And it has ended in a lot of places. It's very hard because right now private health insurance companies have a lot of power. They have a lot of money, so they have a lot of power in the government and all of that. So those experiences really breaks my heart.
Or even the price of giving birth, you know, exactly, in the $20,000-$30,000 range. Don't get me started about Roe versus Wade, but you know, if a woman is giving birth against her will, or that she otherwise would have had an abortion, and to not have access to Planned Parenthood because that's getting cut, the funding for it is getting cut, you know, it's putting that burden on women and especially women of low income.
How
are you supposed to afford that?
I completely agree with that. That's just so horrible. Roe versus Wade being revoked, it was like heartbreaking. It worsens the conditions of healthcare and the health of women in the country, and that also is happening in Puerto Rico. Like because all the laws that in the context of Puerto Rico, all the federal laws affect us. So what happens in the Supreme Court affects us, even if we don't vote for anyone in the Senate, we don't have people representing us. We don't have votes over in the president, but all the things that happen federally affect us. So yeah, there's also a big movement in Puerto Rico working through that, but there's also a very pro-life movement in Puerto Rico that's also working to making a state law of strengthening that Roe versus Wade.
And you mentioned statehood for Puerto Rico,
Mhm.
it's not considered one of the 50 states. So it doesn't have a lot of the benefits, I guess you would say, that all of the 50 states have. Do you think that statehood would solve the issues around the Puerto Rican healthcare system?
No, I don't think so. I think it will help, for example, the Medicaid, that is like the health insurance for the poor, that is the biggest population in Puerto Rico of health insurance. Like I think like 45% of all the island have Medicaid. Even though most of the people in Puerto Rico have Medicaid, our cap for Medicaid is lower than in the US. So for example, an individual who is like under the poverty level has to make in Puerto Rico $6,600 a year to apply for Medicaid. If you make like $8,000, you cannot apply for Medicaid as an individual. In comparison to the US mainland, is around $17,000. And the thing is, the thing is that the prices in Puerto Rico are the same that in the US mainland.
Yeah.
Like food is similar, gas is the same price. You cannot live with $6,000. That's impossible. That's impossible. And that's like the cap that we have. So if we are a state, that cap is going to be, we call it parity. Like we're going to have like that parity with the US. And we also, for the Medicaid program, we have to put more state funds, more funds from Puerto Rico than in the states of the US that come like from the federal level and the state level. In Puerto Rico, most of the funds have to be from the state. And that's basically one of the problems that, in Puerto Rico, we have a big debt of $72 billion. And I think like 30 billion of those 72 were because of healthcare to fund that Medicaid program.
Wow.
Yeah. So if we were a state in that case, at least we didn't have all those 30 billion, or at least some amount of that. Maybe it will be to like 10 or something like that. So yeah, it will help. But I think we also in Puerto Rico have a problem of administration between us, like how the money is running in our island and corruption and all those other problems that also happen in the US mainland. So yeah, I think it would help, but it will not solve the problem. That's like the summary of the answer.
Yeah. So what is the long-term solution for Puerto Rico?
I think that the long-term solution is to plan a state-level universal healthcare system. And it's possible. There are some people in the Senate of Puerto Rico that are starting to work in resolutions for that. I think that there is like $1 million right now to make a study on the possibility of having a universal healthcare system. They have that $1 million to investigate where is the money, how we can rearrange that money to make a universal healthcare system. And that's happening right now in the Senate. I don't know where is it going to go. We've seen how in New York that's being tried to do for a long time, hasn't been successful yet. And in other states, it hasn't been successful yet. But I think it's just like starting to push for that and investigate that, grabbing the numbers of the profits that the health insurance companies are made. Like, where is the money? How can we rearrange? For example, one of the things in Puerto Rico and one of the solutions that I have is that the marketing of health insurance companies, it's crazy. If you come to Puerto Rico, you're going to see billboards of the health insurance companies. And even if when you're putting gas, you're going to see a sticker of those health insurance companies.
Wow.
And when you go, like, it's everywhere. It's not only in the medical offices. It's everywhere. It's way worse than in New York. So we spend a lot, like those companies spend a lot of marketing from our taxpayer dollars. So, or from our premiums, even like that's still our money that is supposed to go to health. So like one of the solutions to that of how we can rearrange is like lowering the price of marketing, but not taking it out completely, but doing marketing on like lifestyle, like healthy lifestyle of like eating well and many other things that could be very beneficial to the country. But we spend money on those things. And that's like the things like, how can we rearrange the people that work in the health insurance companies, how we can rearrange people that work here and all that. I think that's what that project is looking at. And it still hasn't been started, but I'm really looking forward to that. And hopefully collaborating with that project in some way.
That's great. And how can we use Puerto Rico as a model for the US healthcare system?
You shouldn't.
You shouldn't.
Yeah, it's just like it's worse. Well, the privatization is worse than in the US. The profits in proportion, maybe not in quantity, because we also have less people, but in proportion, It's like similar or even higher than in the US. And our system is just breaking down right now. So funny story, Puerto Rico had a universal healthcare system starting in like the 60s, 70s. And like they broke that down in the 90s. And that universal healthcare system that Puerto Rico had was imitated in a lot of countries around the world. It was very effective. It ended up breaking down because it had some problems. There is no perfect healthcare system. There is no country that 100% of the people love the healthcare system. That's never, ever going to happen. But in the US, the numbers, and in Puerto Rico, the number of people that are not happy with their healthcare system is higher than in, I don't know, UK, Spain, Japan, all these other countries. There's really no one answer of like, this is the perfect healthcare system.
Mm-hmm.
I think that the one-payer system is a better healthcare system to what we have right now.
So how can people follow your work and get involved with improving healthcare accessibility and affordability in Puerto Rico and in the United States?
So people can follow me on social media. I have Instagram and Twitter. I'm also going to open a blog. So there's going to be a lot of information there about that. And there's also other people that are working in these topics, but it's just more about right now, I think that the power to push a universal healthcare system, it's on the people. If we leave it to just the politicians and the people with power, it's never going to happen. It's just educating what is happening in Puerto Rico, our context of like being a colony and how we get less money, all of that, that information has to be shared more and more and more. And I think it's happening step by step, but it still needs a lot of improvement. So just like educating yourself about the political history in Puerto Rico and all the problems that are happening right now for being a colony, I think that's a great way to start. And, you can reach out to me and that will be great.
Thanks again, Sergio, for being a guest. And thanks for listening to Making Public Health Personal, presented by the CUNY Graduate School of Public Health and Health Policy in New York City. Check out the episode description for links to connect with Sergio and follow his research. You can now share, like, and subscribe to our show on Spotify, Apple Podcasts, Google Podcasts, and on our YouTube channel. To find out more about CUNY SPH, you can visit sph.cuny.edu or connect with us on social media. We're on LinkedIn, Twitter, Facebook, and YouTube. Just search CUNY SPH. This is your host, Laura Meoli-Ferrigon, signing off. And while public health has a global impact, that doesn't mean we can't make it personal.